4 stages to deal with your diabetes forever. Stage 1. Learn about diabetes. What is diabetes? There are 3 primary kinds of diabetes. Type 1 diabetes, your body doesn't make insulin. This is an issue since you need insulin to take the sugar, glucose, from the nourishments you eat and transform it into vitality for your body. You have to take insulin consistently to live. If you are watching this video for the first time, please kindly like this video, hit the subscribe button and the bell icon so that anytime I drop a video like this you will be notified. Type 2 diabetes, your body doesn't make or use insulin well. You may need to take pills or insulin to help control your diabetes. Type 2 is the most widely recognized sort of diabetes. Gestational diabetes, some ladies get this sort of diabetes when they are pregnant. More often than not, it disappears after the infant is conceived. Be that as it may, regardless of whether it disappears, these ladies and their youngsters have a more noteworthy possibility of getting diabetes further down the road. Stage 2. Know your diabetes ABCs. A for the A1C test. A1C. What's going on here? The A1C is a blood test that gauges your normal glucose level in the course of recent months. It is not the same as the glucose checks you do every day. For what reason is it significant? You have to realize your glucose levels after some time. You don't need those numbers to get excessively high. Significant levels of glucose can hurt your heart, veins, kidneys, feet, and eyes. What is the A1C objective? The A1C objective for some individuals with diabetes is under 7. It might be diverse for you. Ask what your objective ought to be. B for blood pressure. What's going on here? Pulse is the power of your blood against the mass of your veins. For what reason is it significant? In the event that your circulatory strain gets excessively high, it makes your heart buckle down. It can cause a respiratory failure, stroke, and harm your kidneys and eyes. What is the circulatory strain objective? The circulatory strain objective for a great many people with diabetes is under 140/90. It might be distinctive for you. Ask what your objective ought to be. C for cholesterol. What's going on here? There are 2 sorts of cholesterol in your blood, LDL and HDL. LDL or awful cholesterol can develop and stop up your veins. It can cause a coronary failure or stroke. HDL or great cholesterol helps evacuate the awful cholesterol from your veins. What are the LDL and HDL objectives? Ask what your cholesterol numbers ought to be. Your objectives might be not the same as others. On the off chance that you are more than 40 years old, you may need to take a statin tranquilizer for heart well-being. What your A1C, circulatory strain, and cholesterol numbers are and what they ought to be. Your ABC objectives will rely upon how long you have had diabetes, other medical issues, and how hard your diabetes is to oversee. Stage 3. Learn how to live with diabetes. It isn't unexpected to feel overpowered, dismal, or furious when you are living with diabetes. You may know the means you should take to remain sound, yet experience difficulty staying with your arrangement after some time. This area has tips on the most proficient method to adapt to your diabetes, eat well, and be dynamic. Adapt to your diabetes. Stress can raise your glucose. Learn approaches to bring down your pressure. Attempt profound breathing, planting, going for a stroll, pondering, taking a shot at your leisure activity, or tuning in to your preferred music. Request help on the off chance that you feel down. A psychological well-being advocate, bolster gathering, individual from the pastorate, companion, or relative who will tune into your interests may assist you with feeling good. Eat well. Make a diabetes dinner plan with assistance from your medicinal services group. Pick nourishments that are lower in calories, immersed fat, trans fat, sugar, and salt. Eat nourishments with more fiber, for example, entire grain oats, breads, saltines, rice, or pasta. Pick nourishments, for example, natural products, vegetables, entire grains, bread and oats, and low-fat or skim milk and cheddar. Drink water rather than juice and customary pop. When eating a dinner, fill half of your plate with foods grown from the ground, 1/4 with a lean protein, for example, beans, or chicken or turkey without the skin, and 1/4 with an entire grain, for example, earthy colored rice or entire wheat pasta. Be dynamic. Set an objective to be more dynamic most days of the week. Start delayed by going for brief strolls, 3 times each day. 2 times per week, work to build your muscle quality. Utilize stretch groups, do yoga, substantial cultivating, burrowing and planting with devices or attempt push-ups. Remain at or get to a sound load by utilizing your feast plan and moving more. Realize what to do each day. Take your drugs for diabetes and some other medical issues in any event, when you feel better. Inquire as to whether you need anti-inflammatory medicine to forestall a cardiovascular failure or stroke. Tell your primary care physician in the event that you can't manage the cost of your meds or on the off chance that you have any symptoms. Check your feet consistently for cuts, rankles, red spots, and growing. Call your human services group immediately about any injuries that don't disappear. Stage 4. Get standard consideration to remain solid. See your human services group at any rate 2 times every year to discover and treat any issues early. At each visit, be certain you have a circulatory strain check, foot check, weight check, audit of your self-care plan. Multiple times every year, have an A1C test. It might be checked all the more regularly on the off chance that it is more than 7. When every year, be certain you have a cholesterol test, complete foot test, dental test to check teeth and gums, expanded eye test to check for eye issues, urine and a blood test to check for kidney issues. For more information on how to best cure diabetes, I have left a link in the description below. If you have any questions, please comment below and I will respond immediately.